I'm Caitlin, and I use she, they pronouns, and I'm part of the LGBTQ community. I started my journey to become a parent back in 2015, and I now have a daughter who is almost 5, and I have a second daughter who is almost 2, and I'm actually currently pregnant with a surro baby. So I am a surrogate for some friends who are also part of the LGBTQIA community.
My name is Devin, and my pronouns are she and her. I identify as a lesbian, and I live just outside of the Toronto area. My partner and I have a toddler who has recently turned 2 years old. I both carried and birthed her. Throughout our pregnancy, birthing, and postpartum experience, we were cared for by a midwife and a doula. And in the last few minutes of delivery, we were cared for by an OBGYN.
We're a same-sex female couple from the GTA. We experienced going through the IVF process over the past few years, and now we have a daughter who's 16 months old.
My name is Kai. I use he, they pronouns, and I am a birth parent to a toddler at home.
I think that my excitement sort of waned pretty quickly when I realized how the system wasn't necessarily set up to support LGBTQIA people. I felt that I was treated like I had fertility issues when really all I needed was support in helping me get all the pieces of the puzzle together for me to create a family for myself.
I felt as though being queer and experiencing pregnancy, I was going through the process of repeatedly having to come out to each practitioner that was caring for me, or doing an ultrasound, or doing any testing throughout my pregnancy.
When my wife did attend appointments with me, we felt that the care providers were not so much addressing her, more so me, and it was kind of a little bit awkward.
Like, just from the beginning, we tried IUI first, and that experience was like good and not good at the same time. Like, the provider wouldn't even make eye contact with me, but then the nurses doing the IUI made me feel really comfortable and really seen. Um and then COVID hit, and then I wasn't able to go to appointments. And then during the pregnancy or the birth, it was a very similar situation of not really, just I didn't know. I was like, did the husbands get this kind of treatment?
I have had countless times where filling out forms has been incredibly frustrating because it doesn't accurately represent my family. And that just makes me feel frustrated and also not as, I would say, not as equal a member of society. I also think that it's really important to check with the people who are seeking care what they're comfortable with, because everybody has different relationships to their bodies, and we may need to adjust language accordingly.
So the language used by healthcare professionals, it can be extremely affirming to someone like myself, and it can be extremely dysphoric and cause mental anguish for somebody like myself.
I did have an experience that has kind of stuck with me throughout the delivery of my daughter, was when the OB stepped in. He turned to my partner and said, "And who are you?" And that made me feel very uncomfortable, especially in a moment that was already stressful, trying to justify our relationship and recognize that families do look a little bit different to some, and that having two parents that might not identify as a father and a mother, for example, is not something I should have had to justify in the moments before my daughter's arrival. So when healthcare providers make an effort to use inclusive language and not to jump to conclusions when they see, for example, two women with a child, makes us feel welcome and as though we're in a safe space.
What I did when I was filling out all of my paperwork is I would cross out husband and put wife. When they would ask me for my medical insurance, they would ask me, I'd say, oh, it's my partner's medical insurance and I'm on the policy. Okay, what's your husband's name? And I said, I don't have a husband. So it was just, it's kind of frustrating, firstly, not to be seen and assumed that everybody is heterosexual, and also that I have to explain it every single time to people, and that's not something I should have to talk about.
The idea of like when people talk about like coming out of the closet and everyone has that first experience, but in reality, you like come out of the closet like almost every day of your life.
It was just really good to unload that stuff. Not only that, but the birthing experience itself. A lot of people go through very traumatic birthing experiences. And I think that a lot of people don't actually talk about it and process it afterwards. So doing that took a really long time, but in the end, it was super helpful for me to kind of come to terms with what my experience was.
So I've had both positive and negative experiences in terms of health experiences. The negatives greatly impact my mental health, and I'm already predispositioned for postpartum anxiety and depression. When being misgendered, it greatly affects who I am, my identity, and starts to lead to more dysphoric ideation. And positive experiences leave me feeling good about myself, and it greatly increases the chances that I'm going to have a better outcome and relationship with my babies.
I was supposed to have a home birth and I was laboring at home. And at 10 centimeters dilated, it was discovered that my baby was breech. And so a decision was made to rush me to a hospital that I wasn't prepared to go to. And I ended up in the care of healthcare providers that I had never met and that I had no relationship with. And I feel that they did not take me as a human into account when they were dealing with the situation at hand. And so before even a doctor introduced themselves or used my name, they were trying to check my dilation and had their hands in my vagina. And so that was deeply traumatizing for me, particularly as a person who has some sexual trauma in their history. And so it really shaped my experience and left me traumatized after that birth.
Our daughter is our first child, and when she was born, my partner struggled with a bit of anxiety and depression surrounding the postpartum days and weeks. And I found a lot of people turning towards supporting me as the birthing parent, but not a lot of people turning towards offering resources that would support the other mother in this situation.
So some of the happy memories that I have from my first pregnancy was that I had a midwife that was absolutely astounding and would knock down doors and barriers for me and did a lot of advocating for me, which just saves my mental health during pregnancy because I don't always have the mental capacity or the spoons to fight and advocate for myself. So just having that amazing ally right there by my side the whole way through definitely is a core memory for me. I also have to say that I had a 4-day labor that ended in a C-section, and while I lied on the table, to hear my name being called and not having to use my legal name was the most affirming moment that I can recall. And it truly did put me into tears. It was something so small, but something so great to me. I've had to switch care providers due to misgendering and incorrect pronouns and having to consistently use my dead name to sign into places. So I had to push myself this time to find a care provider where I didn't have to explain, ration, or reason with. So it's affected my mental health a little bit more this time around than the last time.
And then like our doula ended up being like just this amazing, amazing advocate, an amazing woman. And she just just made the experience that was so difficult for us so much better. Like without her, like I don't know how we would have got through it. Like the most like memorable experience that I have of the whole process, because like Andrina's like birth process was so complicated and so, like so traumatic for her, but I just felt like I was just like a ghost in the room. But then when she had to have her C-section, so I'm like sitting next to her head and stuff, and they're doing their thing. And then like the surgeon's like, "Oh, here's the baby." And like Eleanor like just made like a little kitten purr. And I was like, "Oh, is everything okay? Oh my God." Like she's not like making a lot of noise. And this one nurse just like came over and she's like, "Come here, come see your baby." And she was just like so excited for me. And I was like, and I hadn't had that kind of experience with anybody the entire time. And like just the way that she like received me and responded to me and like wanted me to like meet my daughter.
I had the opportunity to take a look at my medical chart. There's all kind of information on there like name, birth date, address, diagnosis. So I always wondered what my diagnosis was. And underneath the box, it said same sex. Not sure how it's considered a diagnosis. I would, I mean, I don't know what I would prefer for them to put at that point, but I just found it very almost like, okay, here's a label that I'm going to put on your chart because I don't know what else to put. I don't know what else to say about why you're here.
I almost feel like there needs to be more like questions of like consent to situations that are happening. A lot of times it felt in the hospital like things were just like chaotically happening and no one was really explaining anything, and you kind of just feel like you you lose like all like sense of yourself and like your dignity almost. And I don't know if that's a across the board thing or if it's just a individual experience, but I think definitely like healthcare providers need to get on board more with it needs to be like a team effort.
Everywhere I go, signage is more geared to cis hetero women in pregnancy. So, I mean, positive inclusion would include breast and chest feeding and or body feeding. There's several different languages that could be used. Mommy and me classes, parenting and baby classes. Being inclusive isn't exclusionary. We can all work together to become a more inclusive space.
I mean that they don't have to go through some of the things that I have been through. And so when I say that, what I mean is that I hope that folks can access healthcare without fear and without fearing that they will be misgendered, misidentified, misunderstood.
I wish that this was innate, and that's my hope for the future of any queer folk going through the perinatal, postpartum, birthing, pregnancy period in our Ontario healthcare system, is that this was innate and they didn't have to carve a path for themselves, but rather that there were inclusive environments which can be achieved through allyship and in turn lead to improved quality of care through all of these periods of someone's experience.
Going into the healthcare system and feeling seen and feeling like there's equity there and feeling respected as a human being, regardless of what your orientation is.
My hope in the future is that we can create more safer and more inclusionary spaces for all. I don't do this for myself. I don't do this work for myself. I do this work for the ones that are coming up behind me. So the next generation. I want to be hopeful that there will be a generation that doesn't have to fight for themselves and advocate for themselves to the extent that we have.